Hello, everybody, and welcome to another episode of the Cycle Podcast. I'm very excited today because we have a doctor in the house. That's right, a doctor in the house. So today is not a typical patient story, but I'm really excited to talk to Dr. Shrikhande. She is going to tell us about pelvic health, and I'm very just excited because she has more of a non-operative approach towards endometriosis, and her team is growing. And so thank you so much for being here today. Why don't you just give us a little intro on yourself?
Sure. Thank you so much, Melissa, for having me. And please call me Allyson. So I am a physical medicine and rehabilitation doctor, otherwise known as a rehab doctor. And I live in Florida with my two children and my husband, and two kids who are eagerly awaiting a dog, which we don't have yet. But yeah, I co-founded Pelvic Rehabilitation Medicine with my husband. We did it together. And really our mission is to help raise awareness about the pelvic floor and the importance of pelvic health, and endometriosis specifically has a special place in my heart because we really are on the front lines of endo at PRM. So we see quite a bit of it.
Yeah. So what inspired you to co-found this with your husband? How did it come about?
Yeah, so really my final year in residency in New York City, I was pregnant with my first child, my daughter, and I had severe issues with my sacroiliac joint and challenging prolonged labor, and then postpartum had pain with intercourse, a lot of urinary urgency, frequency, and then a lot of like constipation, pain with bowel movement. So classic pelvic floor issues postpartum. And yeah, I just really couldn't find anyone to help me. And then finally, I found this fantastic pelvic floor physical therapist who really just saved the day and really got me interested in the entire world of the pelvis and the pelvic floor. And it's just, you can't see it. So it's not talked about, and it's kind of taboo to talk about these issues. And really, you don't learn too much about it in residency either. So for me, I was just fascinated by it, and that's how it all started.
And you were probably fascinated because what you did with your therapist at that time helped you feel so much better.
Exactly. It's just
And you
really
didn't know, right? Coming out of like you didn't know, and you were a doctor.
exactly. I've never heard of this. No one talks about these muscles down here.
Of course not. Of course not. They wouldn't. No one's talking about those muscles. Okay. So, but you're different than pelvic floor therapy. So I want to clarify that in the beginning of us just chatting. So you guys are more focused on the pelvis, men and women. And you're really a non-operative approach to finding relief.
That's exactly right. Yeah. So we are as physiatrists, classically we are non-operative, sort of like a sports physicians who we focus on the pelvic floor muscles, nerves, and joints. So we work in conjunction with pelvic floor PT to really reset and retrain the pelvis. So we're kind of we tell patients it's like you're like an iPhone, so I'm going to reboot you and reset the muscle nerve dysfunction that comes along with pelvic pain and pelvic floor muscle dysfunction. So that's conceptually what we do.
Okay. And so people listening, may not have heard of this type of, they might have heard of pelvic PT, but they may not have heard of, what you are doing. What does it typically entail? Is it scary in the beginning? Like, what would be like a first, maybe I'm sure a first appointment would be just general information, but what would happen in a typical appointment to try and shift all of what you're talking about?
Yeah, great question. I mean, yeah, so we would do a standard kind of neuromuscular exam. However, ours, in addition, would include an internal exam, not a speculum, but just looking at the muscles and nerves internally as well. And then we really are trying to come up with a diagnosis as well as a treatment plan. And patients would first start with pelvic floor physical therapy if they haven't tried it already. And then if they have, then we would initiate other things sooner. But conceptually, what we are trying to do is we do with pelvic floor PT a series of external ultrasound-guided hydrodissection nerve blocks with trigger point injections to the levator ani, the muscles of the pelvic floor, and sometimes the external rotators of the hip. It's a very gentle procedure that I developed essentially for safety and comfort. I mean, patients see us at 8:30 or 9 and they're at their 10 a.m. meeting at work. No downtime. You just sit on some ice for 5 minutes and keep going. So really, it's really working to create space and to really calm down any inflammation around the nerves and essentially let your body heal itself. We're really trying to just fix the environment in there and eventually not only help with the pain, but improve function and strength. Because when muscles are in spasm, they're actually dysfunctional and weaker. So we're trying to reset that and help with the pain and then get patients stronger.
Yeah, and that makes a lot of logical sense. Typically, how long will you see a patient for? Is this like once a week for 6 months, or what's it? I know it's probably different for everyone, but what's like a duration?
Oh yeah, no, it's not different. There's a standard protocol. So it's once a week for 6 weeks or twice a week for 3. So
Okay.
quite often, if we have patients either flying in from out of town, we'll try to do it in 3 weeks, or once a week for 6. And you see us in physical therapy. So it's a 6-week process of treatment, and we just treat one side at a time. And again, it's gentle. Most patients are underwhelmed, but it's a process in terms of they're underwhelmed, meaning that was it. But
Right.
it's a gentle increasing space, decreasing inflammation, treating all the muscles and nerves, and it's a trip around the pelvis. So by the end, we treat everything, and and then you do physical therapy for another 6 weeks, and then you come back, and then that's where we evaluate all the progress. And a lot of times we give out a specific yoga program, more of restorative pelvic floor focused, and to strengthen the hip abductors as well, really to support your spine and your hips and your organs of your pelvis.
Right. And so are you guys able to you said diagnose, are you able to diagnose someone with endometriosis?
Yeah, that's a great question. So yeah, I just described kind of a lot of the treatment protocol, the multimodal treatment approach. But for the diagnostic aspect, we see a lot. But for endo is a challenging one to diagnose. It's a silent disease process, as you know, and it can be very, very frustrating because of that. So a lot of our diagnostics is that we are just highly trained in it, and we see a lot of it all day, every day. This is just all we do, right?
Right.
So we just can tell a lot by a history. We do a lot of listening, and a good history can really, we're 95% sure, and then our exam does help us as well. And then we will work with expert gynecological endo specialists if needed. And we do order imaging, so quite a bit. We will get an ultrasound, transvaginal ultrasound or MRI pelvis with contrast. A lot of times the endo does not show up on the MRI. Sometimes something called endometrioma would, or adenomyosis, which often can come with endo, could. So we do a workup if necessary, but we can tell a lot just by listening. Family history is super helpful. And then most patients, particularly if you try our non-operative protocol and you respond, we leave you. If you don't, it's higher likelihood, because you really should respond, because it works. So
Right. Yeah. That was going to be my question, is not that you might know a percentage off the top of your head, but if, someone's maybe never had a surgery, do you see them really, and specifically about endometriosis, do you see that they actually have long-term pain relief?
Well, yeah, I mean, depends on the surgeon, right? And the type of surgery. So, we tend to work more with someone who leans more towards excision.
Yeah. Yeah.
But even with, the highest level excision surgeon, there is still, the data is a 10% recurrence rate in 5 years, right?
Yeah.
So it really does depend. And we do see people, immediately post-op, and then sometimes we're seeing them a couple years down the road. So we do see everything, and yeah, I mean, it really depends on the extent of the underlying disease process.
I mean, have you seen patients and been able to help them without them having surgery as well?
Yes, we do. And sometimes patients, yeah, I mean, when you see us, our first approach is a non-operative approach. We talk a lot
Yeah.
about, other than what I just described with the injections and the pelvic floor PT, a lot about nutrition, quite a bit about keeping your bowels and bladder under control. So a lot of function. We talk a lot about intercourse. As well as everyone's meditating. We go through options of how you want to do your meditating. Is it at home on your own with an app? We use Calm, is very good, is a great app. Or we have a one-on-one cognitive behavioral therapist who works with us. She only does pelvic pain. Or we also started a course called Retrain Your Brain, essentially to really help treat that central sensitization. It's 5 to 8 sessions. It's a group course to help muscle relaxation, deep breathing, diaphragmatic breathing. We talk a lot about that as well.
Yeah.
Yeah.
So how come people, how do I go back to I wish I knew you existed, but I didn't, and as a patient. So how do you guys work on getting, obviously you're coming on this podcast, but how do you get the awareness out there for patients, if their doctor doesn't recommend? And I've never been recommended to see someone like you, or like a physio or a PT, pelvic therapy, how do we fix that? I'm sure you don't have an answer, but what are some of the strategies you guys are working on to help with that?
Yeah, Melissa, it's an excellent question. We are a new field in terms of physiatry focusing on the pelvis. We are, rapidly growing, and a lot of new physiatrists joining this exciting field. So that is a challenge to let people know that we even exist as an option, because we never had existed before. So a lot of what we are doing, we are collaborating closely with local pelvic floor physical therapists, because we are really we're an extension of a physical therapist. That's the rehab world. So that's usually the first place we start, and we really, collaborate to get patients better, and also get patients better faster, so that they don't go into that chronic pain cycle, right? That's our whole goal. We don't want you going in that cycle. So that's what we do. And then we also, we have physician liaisons who let the community know that we're here. So a lot of OBGYNs, we're just colorectals, urologists, GI doctors, anywhere people with pelvic pain would go. But we are a new option that never had existed until very recently. So it is a challenge to get the word out there, and to connect and let people know that we do exist, and we're the non-operative version.
Yeah. And I think what the work you guys are doing is great. I mean, I'm very, grateful to be able to talk to you about all of this. So you mentioned, meditation, diet, inflammation, all of these things. You clearly see a lot of patients, and your whole team does. And just so everybody knows, Allyson's crew is kind of all over the I mean, you're pretty much all over the US. We have listeners outside of the country too, but, so you can find her, and we'll go into how to find her, and her therapist and her kind of team. But, what are some of the main tactics or things that you've seen that we can provide to people who are listening to this, at least to just get started on their own? So I talk about meditation all the time. It's really, really helped me. I try to do 20 minutes a day. I love the Calm app too. I have Headspace. I have them both, but I really do like both of those apps. I think it's really helpful. But what are some of the other things that you've seen that really help your patients initially, even just to get everything a little calmed down?
Yeah, you know what I really like is Dustian Miller's Your Pace Yoga is fantastic, and it can be very specific for either endo or vulvodynia, but she really conceptually goes along with what we at pelvic rehabilitation medicine are trying to do, right? We're really trying to calm down the nerves, increase space and the muscles, and then also after that, get a nice lift and support. So she does all that with the breathing. I think that's the best option, and it's safe, right? It's very safe, restorative approach. Also working on with that diaphragmatic breathing, resetting the sympathetic parasympathetic response, with that vagal nerve, which can upregulate the autonomic nervous system. she'll do that within her yoga. So I think it's a nice all-encompassing way, rather than giving patients 20 exercises to do.
That's such a great referral, and people can do it from anywhere. I assume she's online, YouTube, all of that.
Yes.
That's wonderful. And then diet-wise or nutrition-wise, what are some of the things that you've seen that, people either removing or adding or that have helped?
Yeah, I know. So for endo specifically, we usually suggest a lot of greens, kale, broccoli can help keep the estrogen under control in your body, as it's an estrogen dependent disease process. Also, and very important to keep your bowels moving. We talk, for us, constipation is the enemy of the pelvic floor and the pudendal nerve. So we suggest magnesium citrate, the capsule form, 400 to 800 daily is a nice gentle way to really get your bowels moving. Lots of water, stay hydrated. We can sometimes psyllium husk is a nice option as well for the bowels. For the bladder, we talk a lot about the IC diet, right? So if you have a lot of urgency, frequency, stay hydrated too. Counterintuitively, keep drinking water.
Yeah.
But also take away coffee. So any caffeine, alcohol for the bladder issues. Also a diet low in citrus foods can also help the bladder. A lot of times it's trial and error, see what works for you. And then those are kind of the main nutritional aspects that we'll go through with patients. And then overall, the anti-inflammatory diet as a whole for that whole body inflammation, because endometriosis is a systemic inflammatory process, right? So, it is important to focus on that anti-inflammatory diet as well.
Yeah.
Those are the tips that we'll give.
I think those are great. And I 100% agree. I gave up dairy and gluten, I don't know, over 15 years ago. And it was really tough in the beginning, but now, even if I accidentally have it, I would never intentionally have it because I instantly can tell that I don't feel well and I feel that inflammatory process. So it's not the same for everybody, but something that I usually recommend too is keep a food diary and track how you feel after you eat that food. I definitely notice correlation. And it could even be like, sometimes it was like before my cycle, this food wouldn't bother me normally, but the week before, like I don't feel as well. Maybe it was because I was more inflamed. So it's so cyclical. The more I try, it's crazy. I used to get neck and shoulder pain, which is, and like rib pain, like the week before my cycle. And I always would be like, oh, I worked out too hard at the gym. Oh, like, I'd be like, gosh, this really happens like at the same time every month. So then of course I started tracking it. It was literally the same days before my cycle every month. So I always recommend, and people always hear me say this on the podcast, but really tracking things have really changed my insight as to what works and what doesn't for me. And it's so different for everyone. Like you said, it's so much trial and error.
100%, 100%. There's an app called the Phendo app, Phendo. My friend actually, she started it, and it's great. I think our patients like how you're able to track their symptoms throughout the month. The cyclical nature is useful. The app sets it up well.
Okay. And so that app is I have definitely heard of that app. Is that just a cycle tracking app, but you can also put in symptoms?
No, yeah, and it's symptoms. It's really endometriosis forward, trying to even understand if you have it or not, but it's very symptom based.
Yeah.
And our patients, we recommend they do it. And when they do it, it helps us, really understand their symptoms at a deeper level, as we only have the opportunity to meet them on one day, but we're able to track their entire cycle.
Sure, for sure. So going back to, people have surgery, and I was telling you that I've never had pelvic PT. Do you think that, most people should have pelvic PT if they have endo and they've had multiple surgeries?
Yes. Oh my God.
I mean, I felt like that might have been a rhetorical question, but it's good to it is good to hear, because I do think that it doesn't get recommended.
Yeah, no, I think it should be commonplace for honestly, any procedure in the abdomen or pelvis, really. because it is a trauma or an insult to the pelvis. So
Yeah.
definitely post-operatively, even pre-operatively, if possible, we call that prehab. But yeah, I would recommend, if possible, come and actually see one of our physiatrists, have a proper exam and diagnosis, and then we can give you a script and you can see your local pelvic floor physical therapist. But yeah, no, I think everybody should be evaluated. And, it's not just for pain too. So it's really, if you feel that you're peeing a lot, so bladder urgency,
Sure.
bowel constipation, abdominal bloating, any discomfort or soreness with intercourse or post intercourse. But so there's really a lot of function involved in your pelvic floor muscles and nerves. And to optimize the function, it really is important to have it evaluated and then treated if needed.
Yeah. And if you've been in this kind of chronic, even like without the surgery, you're in this kind of chronic cycle, like you talked about, where you can't break the cycle if you're constantly in it, right? Those nerves. And again, I'm not the doctor, but just based on like what I've felt personally is like, you can't get that area to relax unless maybe you have some assistance or someone to actually show you how to do it.
That's exactly right. It's very challenging, and it is. I've been on both sides, a patient and a physician.
Yeah.
But when it is challenging, when someone asks you to kind of squeeze and release properly, you can't see them, and you think you're doing it, but really they're not firing, and you're not functioning
Right.
as well as you could be.
And you might not know it.
You
Right?
don't know it,
You
right?
may think you are functioning properly.
Exactly. Or you normalize because you learn to live with whatever symptoms you have.
For sure.
So you normalize it. It's just me. That's how I do it. But no, it can be better. There is a better way. Life can improve.
Yeah, that's great. So great. So how are you guys running? It's COVID right now and we're recording this. If people are interested in, seeing you or seeing some of these wonderful people listed on your website, do you offer virtual sessions or how? I mean, obviously that might be a little difficult, but what are you guys doing in this time period and then going forward when things start to open up a little bit?
Yeah, so we do offer a telehealth option if patients prefer. But then we are seeing patients in the office with complete COVID protocol, with PPE and distancing and just standard COVID protocol right now. So a lot of times you could start with the telehealth and then come on in. It is better for us to actually do a proper evaluation, particularly the pelvic floor, because the treatment can change depending on really what we find there. So.
Yeah. And can a patient just make an appointment or do they need, I'm not insurance wise, but they don't need like a referral, they can just, cause you're doctors. Yeah. So they can just call and say, I want to come see you. I've been having this pain.
Yes. You can call, you can go to our website at Pelvic Rehabilitation Medicine, and really there's a contact. You can just email us and we can call you, which a lot of people do, or you can call our number as well. Yes, you can just reach out and we'll help set you up.
Okay. And then the ROSE study, can you tell us, I saw this on your website, can you tell us a little bit about what this is and how it could potentially help endo patients?
Sure. Yeah, so the challenge, as we were mentioning before with endometriosis, as it's challenging to diagnose it. And what the ROSE study is research outsmarts endometriosis. And really what we're doing is looking to analyze menstrual effluent and the different biomarkers that may be found in people who have endometriosis and people who don't. So essentially the hopes of asking somebody, okay, take this pad home with you, put it on overnight when you have your period, and then we'll analyze it and we'll let you know if you have it or not. You don't have to go through a surgery to figure this out. So ultimately that's the goal we're doing. Yes. So we are co-investigators on the ROSE study, and the first paper was recently accepted. So, but we're just going to keep going because the more patients, the better. And we actually need everybody. Any female who's menstruating can participate.
Okay.
I think it's for the better of women out there who we really should be able to tell them if they have endo or not without a surgery.
What 100%. I couldn't agree more. And, that goes back to even the 7 to 10 year diagnosis wait, and which is what I definitely had because I was struggling in high school and was told it was normal. So, if I would have been able to do something like that, it really would have changed my life. I mean, it really would have changed the entire course of my life. So, such an important study. That's also on your website, but I'll link your website and the Rose study in the show notes for everybody. Is there anything else you want to say to, endo patients who are listening? Last words, kind of tips, tricks, or anything that we missed?
Yeah, I just know your own body and also speak up for yourself, be your own advocate, and just know there are specialists out there who really understand endometriosis and its connections with your symptoms and with the muscles and nerves. And there are treatment modalities out there that are non-operative. So really seek out help, and quality of life and is so important. So you deserve it.
Yeah, absolutely. And I couldn't agree. And, there's a lot of people that can't access having surgery as well, too, which is why I think this conversation is so important. So,
Yeah. Thank you.
well,
Yeah,
Allyson,
you're
thank
doing
you.
great work. This is a wonderful podcast.
Oh, I appreciate it so much. Well, I really appreciate you coming on and chatting with us and, giving us a little bit of education about what you do. I think it's really helpful. And, there is a doctor here in Michigan that I think I will go see because, I've never seen anyone in that area. So I think it would be actually really helpful for me. So thank you so much.
Wonderful. Thank you for having me.